So, welcome everyone. I'm Lily. I'm the founder and CEO of Auggie. I'll be moderating tonight's event, Starting Solids 101. It's in partnership with Solid Starts and Ahimsa with support from our friends at Little Spoon. Auggie is a parenting platform grounded in trusted experts like these two women and shared experience from the parents in our community. So, you're in a really good room tonight. As we go, feel free to drop questions into the chat. I'll do my best to surface them. That said, every month we host this workshop transparently. We do not get to all of the allergen questions usually. But on January 20th, this same group, and I'll drop the link in the chat, is hosting this type of event, but much more specifically on allergens. So if you have more questions, feel free to jump in there. And then Kary and Manasa, I'll let you introduce yourselves, but Manasa is in the car, as you can see, are one of our resident experts on the move, working mom, doctor, and on the go. So Kary will really take the lead here and Manasa will support. But Kary, do you want to introduce yourself first?
Yeah, perfect. I'm Kary Rappaport. I'm a pediatric occupational therapist and board certified lactation consultant by training. I have been doing that work for the past 20 plus years, and I have worked with a very wide different population set during that time. So I've worked for over a decade in large children's hospitals with medically complex infants and very, very sick children. I have worked in home with families of typically developing kids who are starting solids or dealing with some picky eating. I have worked in doctor's offices. I've kind of worked the whole spectrum of different places you can work with infants and toddlers and families as they are dealing with or learning about eating and swallowing. So I currently am the executive director at Solid Starts. I am one of the founding members there. Solid Starts is an organization dedicated to helping families start solids with their babies and raise happy eaters. We have an app that people love and a website that has tons of content and information, and an Instagram page that also puts out a ton of content on a
I
regular
literally just like bought the app and like subscribed to
basis.
everything tonight. So I'm so excited.
Hey,
Obviously I was a user with my 4-year-old, but now it's a whole different ball game, as you know. Oh, good. Lots of people are saying they love solid starts. Manasa, do you think you can do a quick introduction? You're a little spotty, I think.
Now, can you hear me? No.
Yeah.
Okay, kind of. My name is Manasa Mantravadi. I'm a board certified pediatrician. My expertise really is in pediatric endocrinology and culinary medicine. So really bridging the gap between long-term outcomes for kids and food as health. I have been practicing, for many years and now treating a lot of patients, really moving into the preventative space because we know an apple a day keeps the doctor away is a real thing. And so the more we can do from kind of the starting solids and food as health movement, we will see healthier children down the line. So that's kind of where I practice now.
Cool.
And I am the founder of Ahimsa, which is a line of stainless steel dishware for kids, really designed to remove the harmful exposure of plastics in children's dishware. So really getting healthy food, healthy habits, and healthy mind at the dinner table. So I'm excited to hear.
Awesome. We got the majority of that. So win-win over here. All right, Kary, I'm going to head over to you to start.
All right.
And I have this question for Hudson right now. How do parents know when their baby is actually ready to start solids? I know in my house there's a lot of looking at food right now.
That's great. It sounds like they're on track then.
Cool.
Well, it's not necessarily any specific date that you are
Yeah.
going to start. A lot of times, parents believe that they're supposed to start when baby turns a certain age. And also historically, a lot of medical professionals have recommended that. So you'll hear people say,
Yeah.
oh, baby's 6 months, time to start solids. Baby's 4 months, time to start solids, things like that. The reality is, you're looking for a baby to show you a set of developmental skills that tell you they're ready to start exploring solids and they have all the foundational skills that they need to do it safely. So those big skills are, there's really three. Sometimes we break it down into four, but the ability to sit up, and it doesn't have to be perfect sitting. It doesn't mean your baby has to get in and out of sitting by themselves, or that if you place them in sitting, they have to be able to perfectly sit up and do what they need to do. They just have to be able to keep their trunk up. So if you put your hands around their waist, or you sit them on your lap, or you put them in a high chair and the high chair walls itself are kind of holding them up, that's fine. You just don't want to see a curved spine. So babies who aren't quite ready tend to kind of fall forward, they hunch their back and their shoulders. Or you get what's called prop sitting. So they're using their hands to sort of push themselves up, but they can't use their hands because their hands are holding them up. So you need to be able to sit with enough strength in your trunk that you can kind of keep yourself up. That usually happens for most babies around 6 months old, but it can happen for some babies even as early as 4 or 5 months old, and for some babies closer to 7 months. The next thing is that you need to be able to use those hands. So like I said, hands that are propped to sit are going to be a barrier for self-feeding or for participating in feeding because their hands are now used to keep their body up. So you want to be able to sit up with some control, to reach out with the hands and grab a toy, or if you're at the table, to grab food or to grab the spoon, and then pick it up and bring it to the mouth. So baby has to be able to sit. They have to be able to use those hands and arms flexibly. And those two things really go together. A baby who has enough strength in their core to sit up should have enough strength to reach out and grab, and then they start to do that. You'll see them really explore their environment once they can do that. If your baby can do that on their back, but they can't quite do it when they're sitting up, that tells you they're not quite ready yet. The third thing that we see is an interest. Usually interest follows those things, but in some families, they'll say their baby is so interested at 3 and 4 months, even though they can't quite sit up yet. And so we're like, okay, well, the interest is there. That's great. But we want to wait for those developmental skills of sitting and reaching and grabbing to get established as well. So you really want to see all three things together. Usually they sort of happen in concert, again, around 6 months old, but you're looking for them specifically to show up in your baby. And that can be somewhere between around 4 to 7 months old.
Okay, wonderful. And Dr. Manasa, I feel like you always say readiness is about like development and not age too. So as a pediatrician, I feel like you've been on that side of the fence as well, but I don't know if you can
That,
hear us.
that's right. I don't know. Can you hear me? I am going to stop here shortly, so hopefully I'll get better.
Okay, cool. We may hear you better if you go video off.
Yeah. Okay, perfect. So I think that's the one thing that people need to, is that better?
Yes.
Yeah, that's perfect.
Yeah, so I just, I fully support everything that Kary just said. I think traditionally, the one thing I will say is if you ever have any questions about the proper age, and your pediatrician might, have different opinions, I think it's really important to have these conversations with your healthcare provider. So the classical thinking early on, like back in the day, was that you really start solids at a certain age in a certain way. And we know the new science kind of shows that you can start it around that 6 months age because of the developmental milestones. And like the way that we do it is not necessarily spoon fed in the same way that we used to recommend it. So I think it's just important to have these open conversations with the provider back and forth. And yeah, feeding is all about practice. Everything that Kary just said is a developmental milestone and a motor milestone and a social milestone. And so feeding is so much more about development than nutrition at this age.
Yeah, and I really love that you guys encourage like baby's pace and not outside pressure, because I feel like there are so many things that parents get pressure for, and this shouldn't be one. Like really, if your baby isn't doing the things that Kary mentioned, it's not time, and it needs to also be the right time for you at home to introduce these things to your child. Okay, I want to get into a common question we see in the community, which is feeding styles, baby-led weaning versus purees. And I know when I told my mom I was doing this baby-led weaning concept, she was like, "What?" So, Kary, can you get into how it's changed over the years and the difference between the two approaches, please?
Yeah, like I said, I've been doing this for over 20 years. And so there has been a huge shift in the way the
Yeah.
vast majority of people are introducing solids now and in what we know about how infants learn to eat. So historically, there was what we called the traditional approach, and that has sort of been the one and only approach that we were using here in the United States and in a lot of places throughout the world for about the last I don't know, at least 75 years. Prior to that, a lot of times people will say baby led weaning is new. It's not actually a new concept. It's a concept that has been around for millennia in lots of different cultures. But when traditionally pureed, industrially created baby foods came on the market, we sort of shifted to this traditional approach of starting solids, which is very much the idea that you start with a stage one puree that
Yeah.
you move slowly through the stages to slightly thicker, slightly more textured purees, eventually getting to small pieces of food where baby can pick up those little pieces of food and eat them, or to meltable foods like a teething biscuit or a puff or something like that, that will sort of melt away in baby's mouth. And then eventually you're going to get to bigger pieces of food and to finger food. That's the traditional approach. And when I started doing my work as an occupational therapist, that was the only approach that I was taught. That was how you fed infants. Around 15 years ago, the idea of baby-led weaning sort of emerged onto the scene. Again, not new, but newly talked about. And a book
Which
came.
is why your parents may be questioning your, yeah.
Totally, totally. Whereas like grandparents, surprising, sometimes grandparents are like, yeah, of course, that's how we fed you, fed your mom.
Right.
But even beyond that, that was common many, many, many years ago. But baby-led weaning is the idea that babies who start solids at around 6 months old, when they are showing those developmental readiness signs that I just mentioned, they have a skill set that allows them to do a lot more than just explore purees. And that actually the research shows us that the food itself, when you jump into finger foods, when you actually serve baby bigger pieces of food, those help trigger baby's chewing reflexes and help them learn how to eat a wider variety of food. And that purees actually, if you serve them and stay with them too long, can slow the process down and make it more challenging for baby to learn how to chew and to transition onto finger foods. So it's not that there's anything wrong with starting with purees. That's a wonderful texture for a new eater. It's just very similar to breast or bottle feeds. It's similar to milk. So they're not actually learning new skills. They're just kind of meeting them right where they're at and allow
Mm.
them to taste some flavors and things like that, which is just fine. But we actually have to jump to finger foods within the first few weeks or month or so in order to get them practicing chewing so that they learn how to eat, because there is a window from around 6 to 8 months old where a baby is most developmentally open to learning and building those skills. And when we give them the opportunity to explore finger foods, they naturally build those skills during that window.
And what about a hybrid method?
Yeah, so a lot of people ask about that. It is, again, perfectly fine to do a hybrid method. If you're nervous, it is a great idea to start with purees, because the finger food idea, while I can talk a lot about the risk of choking and why that is more of a outlandish fear than it is a reality, there is a tiny bit of risk when you put food in your mouth. We know this as adults. There's a risk to us too. And actually, the research shows that the risk is higher in older adults. So when you get into the geriatric population, unfortunately, grandpa or grandma is more likely to choke and to have an event of choking at the table than baby is. So
That statistic continues to haunt me. I feel like, can you say what it is that the choking stats in this country or something, majority of the incidents come from non-food related
yeah,
incidents?
so I don't actually know what the numbers are in the geriatric population. I just know that they're higher in the geriatric population than they are in the infant population. But in the infant population, it is less than 1% of infant deaths, which is it's always scary to talk about infant deaths. But as parents, we have so many things to worry about, and
Yeah.
we worry constantly about things that are going to harm our babies. Less than 1% of deaths come from choking, and out of that number, more than half of those are choking on non-food items.
Yeah.
So it's very unlikely, but in the event that it happens, it's much more likely to happen on non-food items rather than food items. So we want all parents to be ready to take infant CPR classes to know how to respond, because it does happen, but it's not likely to happen on food seated at the table.
And we'll get into more about the gag reflex and choking in a little bit. I want to bring up a question from Jacqueline in the chat. If starting with purees, how long should you stay with purees before moving to real food? I know you mentioned that 6 to 8 month window, but what do you suggest there?
Ideally within a few weeks or within the first month.
Okay.
So we want baby to practice chewing, and the goal is to get them eating a variety of foods before they hit toddlerhood, because everything kind of changes in toddlerhood. Suddenly you have this, what was a very open, eager to explore baby turn into this toddler who loves saying no and kind of shuts everything down. So the
Yep.
more skills they build before then, the better for them because they are more likely to continue to accept what they've been accepting. And the more practice they have, the more skills they build. So think about if you suddenly took up basketball today, you're going to be better at it in a year than if you waited until November and were like, okay, I'm going to get into basketball and practice for a month. The more we practice, the more skills we build. So it is the purees are great for certain things, for flavor
Okay.
introduction. They're good for a baby understanding how to be at the table and how to pick up a spoon, but they're not going to push their chewing skills forward. And chewing is the main thing that your baby needs to learn in order to eat a wide variety of foods.
I like
Doc-
that comp you made about like if you're just continuing to do purees, it is so similar to breast milk or formula that they're not learning that skill of chewing. With this topic on baby-led weaning, I just want to bring up Ricky's question, which is how do we ensure baby receives enough iron with baby-led weaning? Our nurse said the only option they're allowed to suggest is that processed fortified cereals and oatmeals.
Dr. M, if you feel like you can talk, why don't you give it a try? So I feel like this would be a good one for you, and then I can take it if it doesn't seem to come through.
And just to reiterate, the question is how do we ensure baby receives enough iron with baby-led weaning? But I don't know if she can hear us, Kary.
Okay, it's fine. I can. Dr. M, you're muted. Okay,
I think
I'm
I
just
can
gonna.
unmute her. Oh no. You go ahead, Kary.
Okay, anyways, so the thing is that right at first, baby is learning how to eat. So there is no way to assure baby gets an adequate amount of iron from any sort of food, even iron fortified cereals. I have worked with so many babies over the years who staunchly reject purees, will not touch iron
Yeah.
fortified cereal, will have nothing to do with it. So what we know is that iron stores start to be depleted around 6 months old. It is not a hard shelf where they hit 6 months old and they fall off it and now they need iron. If your doctor believes your baby to be at higher risk of developing iron deficiency anemia or having some iron deficiency, then the best step would be to talk to them about whether or not your baby needs to be tested for their iron levels and then potentially supplemented with an iron supplement. Because what we know is that babies need time to learn how to eat. And it's not reasonable to expect them to eat even iron fortified cereals or any type of puree right off the bat. A lot of babies need several months to figure those things out, especially when it comes to finger foods. They're going to need several months of practice to get those finger foods in. So what we recommend is just serving a wide variety of iron-rich foods. And that can include iron-fortified cereal if you prefer, or again, just meats and fish and beans and things that are naturally higher in iron alongside foods that are higher in vitamin C, knowing that the average baby, as they gnaw and as they eat, will start to swallow little bits of it. And so they're getting iron through those methods. And if there is no, you can't look at a baby and say, yep, they got enough iron today, and nope, they didn't. So you do want to check in with your doctor periodically. And if they believe that your baby has some type of higher risk than other babies, then they would go ahead and consider supplementing.
That is so helpful. And I didn't even like think about iron. So I'm just so glad again that we're doing this conversation. What if foods, and this is from Alpa, thank you for this question. What if foods are not exactly pureed, but mashed with texture in it? Is that different or better for learning to chew?
Yeah, the more texture a food has, again, the more likely the jaw is to start moving and the tongue is to start moving. So thinner purees, again, get processed in the mouth based on research, similar to a liquid. The tongue pulls them in, moves them back, and swallows it. We don't chew a puree. Our jaw doesn't start moving, whereas a lumpy mashed food might get us chewing a little bit. But what we're trying to do is give a lot of input to baby's jaws to really get that chewing reflex going. And it is a reflex. Baby doesn't have to know how to chew. When things touch, especially firm things, touch baby's gums, their jaw responds with a reflexive
Oh,
and down movement.
wow. That's really interesting. Somebody's saying, what if we waited more than those few weeks to, introduce more solid foods? They've been doing stage two purees. Are they behind? And it seems like a few people are questioning that
Yeah.
as
So again, I've been doing this a very, very, very long time, and I will reassure you that babies are adaptable, incredibly adaptable. So the more practice, the better. if you're asking me what I would suggest, I'd suggest moving on within the first few weeks. If your baby is 9 months or 10 months or 12 months and you're like, oh my gosh, Kary, I have not started those finger foods yet, which we get messages like this all the time. I will tell you that the research is clear. Your baby can still learn those skills. It's just a little bit more challenging, and it tends, based on the research, which the research isn't every child. The research just shows in general, it takes them longer to learn the skills that are easier to learn here. So that just means things might be a little bit more challenging. You might have to wait a little bit longer, push them a little bit harder to get there. That
I
said,
just love your language because even you saying in general versus like the norm makes me feel better because there isn't the norm when it comes to kids. Every kid is so different, right, Dr. M?
That's right. That's right. And sorry, we did stop. So now hopefully we just got reset up here. So
I just feel bad
I,
for whoever's driving that car you're in because the stress
yes,
level must have been high.
it is. He was like turned around and just, if anyone's an Indiana fan, that's why I'm driving in the middle of the night. I'm going to the IU football game
Oh,
tomorrow.
go
So
IU.
go
I'm
IU.
not, but
Yeah. So one thing on the iron deficiency. So sorry about that, but Kary, you did an excellent job. And I just want to reassure people when Kary was saying your physician will help you look out for signs. Typically, babies are born like with their iron stores. And when we typically see iron deficiency anemia is actually in toddlerhood when children are kind of introduced to cow's milk and end up drinking a lot more cow's milk than they need to and not supplementing with other iron-rich foods. And so typically that's what we see. So just a little supplement to everything that Kary said, which was perfect. And so what was your question was on just now, Lily?
oh, the question was on
Oh, normal. What's
the
normal
normal.
and what's
Exactly.
actually average? And so I love Kary and I speak about this a lot. You know, it's not really it's there's a bell curve on just in general what kids are supposed to do. So I think those little things for parents, especially if you're a first time parent, understanding that there is not a specific way. There is a general curve on overall your baby meeting these milestones. Are they meeting their growth and development? I think one of the things that people get really freaked out about when they're starting solids is, oh my gosh, is my baby eating enough? Are they getting enough nutrition? Am I doing this right? And I think that is a natural point where we can really ease people's concern. The first year of life is really about learning these skills when they're learning to introduce solids.
Yeah.
Nutrition is really by breast milk and formula. And so, you know, if when your baby is drinking breast milk and formula, they're actually getting the caloric intake that they need to grow within that first year. So as we're introducing solids, it's a lot more about using those developmental milestones to practice this new skill and chewing and bringing things to midline, sitting up straight. So that already, I feel like when we tell people that, I can like feel people's shoulders go down, feeling like, oh, they're not relying on my methodology on how to introduce solids to, you know, survive. The answer is no. Like they're just there for practice.
Okay, that is so helpful. Now, I want to get to allergies because I know that a lot of people have questions here. But before we do, Kary, what do you recommend the first few foods should be that you introduced? I'm seeing that question get asked a lot. And I think that's mostly focused for baby-led weaning, like chewing foods.
yeah. First of all, Dr. M, I love that. You're always so calming. So I was like, oh, I hope she
I
can.
just wish she could be my pediatrician. I'm like,
I
could you
know,
move
I
to
know. I
Brooklyn?
always feel like after I hear you, I'm like, we're gonna be fine. Everything's gonna be fine.
Yeah.
Um, but so when it comes to the first few foods, the okay, I'm gonna give like maybe a slightly less satisfying answer than people want, and then I'll give you maybe a slightly more satisfying answer. But the answer that I prefer is that there are hundreds of good first foods. That the best first food for you and your baby is gonna be different, Lily, than my
Yeah,
best food for my baby because I live in a different part of the world, because my baby might turn 6 months at a different part of
what
the
you're
season and what
comfortable
is
with.
exactly. And my family eats different foods than Dr. M's family or than your family, Lily. So I want to aim for the foods that I love. Those first few foods usually are closer to single ingredient foods. You can start with vegetables or you can start with fruits. The research is actually not solid on that, on which one is better. A lot of people believe that if you serve fruit first, baby is never going to take your veggies. Again, we know that babies have a preference for sweet. We know that the more they practice with things that they're not so sure about at first, the more they learn to like them. So there is some theory behind the idea of serving veggies first or serving some of those before you get to fruits, but it's not clear that if you start with fruits they'll never get to veggies, or if you start with veggies they're going to love veggies. So we don't have a solid idea there, and we know that iron rich foods are important. So again, serving iron rich foods early on and often can be very important. So aim for foods that you love, that are fresh, seasonal, local, and single ingredient right at first is ideal. So things that are easy that a lot of people go for are something like avocado, because it will ripen, it is naturally soft. You open it up, you scoop it out, you can mash it and leave it a little lumpy, or you can serve baby strips of it if you want to go with a more baby-led weaning style approach and let them explore it. Another one that I absolutely love is a broccoli floret. You steam it until it's,
Easy.
yeah, it's easy. It's readily available for most people. You can buy frozen and then thaw it and cook it however you want. Roast it is one of my favorites, but you can also steam it or boil it if you want to. You want to try and leave it a little bit firm. So soft enough that it's, you can like press on it and it will flatten, but if it's too soft, baby will almost definitely start gagging and it will freak you out right off the bat. So I'd say leave it a
Which
little
we will
bit.
get to the gagging, I
We
promise you,
will, we
because we
will.
know we know that's a big hitter.
But
Um,
it doesn't have strong jaws right at first. So broccoli, the other one, sorry, that I love is
oh,
mango.
go ahead.
Mango is
Mango.
like one of my favorites, Lily. It's one of the first foods that I served for my son. So you have lots of ideas. There are meats and other things, other directions you can go, but those are some good ones.
And how do you feel about a frozen mango pit? Because I feel like that's also really nice for teething.
Frozen mango pit is great for teething. As a very first food, a frozen item might be a little intense, but you could do it.
Yeah, I
Go
get that.
for it.
A
And
little jar.
this brings up a point too, on kind of textures, because as we talked about, starting salads is a lot about learning new skills, and a lot
Mhm.
of that is new textures. So it's not just the motor skills that they're learning to do; it's experiencing different flavors, different temperatures, different um,
Yeah.
textures. So even something like when I first started feeding my twins raspberries at this early age, they loved it. And then later on as a toddler, one of my twins decided she just didn't like raspberries. But then what we ended up doing is I just, would freeze the raspberries, and she liked the texture of frozen raspberries. So I think it's just, again, there is no right way. Every baby is different. And every baby who then turns into a toddler might be two different humans.
Yeah, great. Parenting is not linear. Awesome. Um, okay. Do we keep the same amount of breast milk and formula feeds when introducing solids, or what does that feeding schedule look like?
Go ahead, Dr. M.
Yeah, that's a good one. So in general, again, Kary and I love to say in general because it really is dependent on your baby. But in general, you continue your regular like feeding, and as you start to introduce solids later on, as you get into toddler, we really are aiming for more like that 3 meals, 2 snacks, and we kind of head towards that. But in the beginning, really, what we want you to do is feed your baby with the breast milk or formula first, because that is where they're going to get their nutrition. So the formula feed. So obviously when they're very little, you might be feeding them every 2 hours and then every 2 to 3 hours. And then it kind of spreads out to, every 4 to 6 hours, a few times a day. So what I would say is in general, if your baby is hungry for a feed for breast milk or formula, certainly feed them. One of the reasons that we want you to do that nutrition first before they start their solids is we don't want to get them so full on these other things. And some babies, Kary could probably attest to this, they'll just keep eating because it's fun and it's tasty. And what you really want them to first do is fill up on that nutrition. But in general, as we move from every 2 hour feeds to toddlerhood, it's about 3 meals a day and 2 snacks. So
And if
that,
you're breastfeeding, will your supply adapt over that time?
yes,
Great.
that's right. That's right. And I
Okay.
think that's another thing I tell every new mom about. And I know, Kary, in terms of lactation, I think if every parent can understand that we are designed to feed our babies, right? And that we are, that babies are designed to figure it out. Like all of this feeding stuff starts to feel a little bit better because intrinsically, like our body will make enough milk for the baby that is consuming it. Naturally, your baby who then turns into a toddler will consume enough nutrition over the course of a week to sustain life, right? So I think once we can kind of zoom out and really understand that the human body is designed to do what it is, then it takes the pressure off us as parents to feel like
Yeah.
you have to control every little thing.
Yeah. And Kary, I'm just seeing, oh, go ahead.
Well, I just wanted to add, like, we've said this a little bit, but remember, baby is learning a brand new skill set, and it's a complicated, complex skill set. It doesn't feel that way to us because we've been doing it for a long time.
Yeah.
But to baby, it is an entirely new world of moving food around their mouth, of chewing it, breaking it down, figuring out how to safely swallow it, how to manage those flavors and those textures. We don't expect the baby who is like cruising along some furniture and just taking their first steps to then be like, let's go on a hike. Like,
Yes.
let's go straight to the big legs. You give them time to get there. The same is true at the table. They are just barely learning these new skills. So breast milk and formula are your safety net. They do not need to eat those foods right at first. They need to figure out how to eat those foods over time so that when they get to toddlerhood and their nutritional needs start to shift and breast milk and formula don't contain all those nutrients that the toddler needs to move forward, they are able to eat a wide variety of foods. So your 6-month-old, 7-month-old, 8-month-old baby, we don't actually expect to eat hardly anything at the table. And there are days where your child, your baby might spit it all out and not eat anything, or days where they're sick and they refuse it all and they're just getting breast milk and formula. That's fine. They're getting what they need, their nutritional and hydration needs met through that breast milk and formula. So it really should be secondary, the solids. So when people ask, for example, should I give a full feed before we come to the table? Yes, give a full breast or bottle feed. Your baby doesn't even know at 6 months old that food is food. They
Right.
believe that food is a toy. So they're going to explore
Toy.
the food as they would a toy, not because they're hungry. So you don't need to bring your baby hungry to the table. We usually say feed them around 30 minutes beforehand. You can wait an hour. That's fine too. We don't, some babies will tend to be more vomity and gaggy if you feed them half an hour. So an hour gives them a little bit of time to digest that milk, but you don't want them hungry or they will be frustrated because they don't actually know how to get in.
Yeah.
Yeah.
Yeah, go ahead.
I had just a real quick piggyback too. We keep talking about skills, and I know we always talk about starting solids, and solids is an important one, but actually another great area and skill that we, like Kary and I talk about a lot, is an open cup and really like drinking, because that is the natural next step. So like there's two skill sets, right? Chewing your food and eating, and then consuming liquids in a different way that's different than the suck and swallow mechanism. And so actually in many parts of the world, especially like I'm from India originally, we introduced a cup at a really young age. And so it is another.
What is that age, Manasa?
Yeah, so you can do it even as early as 4 to 6 months, where they're just starting to kind of, again, reach to the midline, grasp, bring things to their mouth naturally. And so the earlier you start these skill sets, like don't underestimate like babies and toddlers and kids, like they really can learn these skills. So just like baby-led weaning, open cup introduction is a great thing to do around the same time. But again, the goal is not for them to drink a cup of water. The goal is to have nutrition first, breast or formula feeds, a little bit of solids to kind of understand how to bring things to the mouth, and then also open cup with just about, I usually do at Ahimsa, we have a 4-ounce cup, really perfect size for baby to hold, but you don't fill it up all the way. You might just do like a 1/2 ounce or just a 1 ounce. And it's really for them to start practicing. And I think Solid Starts has some great opportunities to learn on how to do open cup feeding on their site too.
You know, this question came up, and I'm always surprised when there's a question in the chat that we haven't heard before. So does teeth or lack of teeth change anything in terms of baby-led weaning or feeding in general?
Oh, I love that question. And not really.
So intuitive when you think about it, but
yeah. So we don't, so, okay, the teeth that we use to actually grind and break down food as adults are our molars. Your baby does not have molars and won't get molars until well after 12 months. A lot of babies don't get molars until 18 months or 24 months. So they should be eating a wide variety of foods by that point. So we know that molars aren't essential. We know that if you put your finger in baby's mouth, their jaw is so strong without any teeth at all. And those little bunny teeth that come in the front, their uppers and their lowers, which are going to be the first sets of teeth that they get, are biting teeth. They're to take bites of things, not necessarily to chew and grind things. So they don't need those teeth to get started. They can do that, all the things they need to do without those teeth. And if those teeth are present, which is, we get the flip of that question a lot as well, those teeth don't mean that you need to hold off. It means that your baby probably will learn how to take bites out of food a little earlier than a baby who has no teeth, because those sharp teeth just naturally cut through things. But we want your baby to bite into things. We want them to bite off pieces. I know it feels very scary and it feels counterintuitive. Like, oh, if they're biting pieces off, they're going to have this piece in their mouth and they're going to choke. The food itself triggers babies' chewing reflexes, which helps them start to learn how to move the food around, how to break it out, and it helps them build what we call the mental map of the mouth, which is the ability to say, yep, that is chewed enough that I can spit it out. And we've talked about this before, but imagine you have a bite of an omelet and you suddenly crunch a little bit of an eggshell and you're like, oh, I gotta
Not
get
ideal. Yeah.
not ideal, but our mouth and our mental map of our mouth is so strong that we typically, as adults, can sort of like sift through that bite of egg, especially if you're like socially in a setting where it's not appropriate to just spit it out.
Yeah.
Usually sort of isolate and find the piece that's the problem and then spit it out and then continue
Yeah,
to
keep
eat
going.
our egg. We have a very strong ability, sensory connection with our mouth to understand what's going on in there. It takes babies literally years, it's up until around 5 years old, to build that mental map. And so at first, they're just learning how to move those pieces around and they're going to spit them out because their reflexes like sort of elicit that. They sort of force them almost to spit it out or to gag it out. And then eventually they're learning how to break those foods down. So we want them to bite it off. Those teeth sometimes will help babies figure out earlier how to bite pieces off, and that's perfectly okay.
Okay,
And
great.
Kary, this might be a good time, Lily, just as a
Yeah,
follow-up to that.
please.
I think, Kary, you always do a good job because this is one of, I think, the most concerning things for parents. They get freaked out about choking versus gagging. And I think
Let's do
it's
it.
it's a really important distinction to make people feel better and to understand. So I know, Kary, you do such a good job. And on Solid Starts, it's really demonstrated well. So I'd love to kind of follow up with that, Kary, if you
And
could.
Kary, just before you get into it, I just like for someone who's a first-time parent and has never done solids with their
Mhm.
kids, like my best friend Jessie, I actually think she's on this event, but it's her first kid and she wasn't even aware that kids gag when food goes in their mouth. So maybe like start there that
Okay.
is what happens
Yep.
and that's normal.
Yep.
Okay, that's helpful. Okay, so your baby has a set of reflexes, and we call them mechanisms because it's sort of like a grab bag of things going on in their mouth that help them learn to eat and that keep them safe as they do it. So the gag reflex falls into the bucket of a mechanism that sort of keeps them safe as they learn to eat. And under the bucket of mechanisms that they have to learn to eat, they have that chewing reflex that I talked about. So you put your finger on your baby's gums, they should start to munch. They don't have to be taught how to do it, they just automatically do it. Another thing is usually when you touch baby's lips in the front of their mouth, their tongue wants to poke forward. That's a reflex. It actually helps them spit food out at first without you needing to teach them how to do it. It's a really good, strong reflex. The gag reflex is that moment where, and you as adults, usually we've all gagged, like something moves too far back or your finger gets back there or something, you're feeling bad. You get that nausea feeling and you retch. So you're going to have that sort of open mouth and that tongue moving forward like you're going to throw up. And what happens when you do that, when a baby gags, is that the back of their throat actually starts squeezing. So, in an upward motion to pull up things, content from the stomach and to move it back out. So, anything that's in the stomach, anything that's in the throat, anything that's up here in the back of the mouth is getting sort of squeezed and pushed up and forward to get it back out. That's why we tend to throw up when we gag. The other thing that happens when we gag is that the front of the throat, so we have these two tubes. We have a food tube where food goes down, and then we have this airway tube in the front. The airway tube closes because your body does not want content from your stomach, which is acidic, to end up in your airway if it's coming back up. So it will naturally
Hmm.
close. which is actually great because if your baby is gagging, a lot of people think that means they're choking. That means food's going to go right into that airway and it's going to make them choke. But the reality is that just your body's like, nope, protect that, close that, and then start squeezing so that anything that's back here or anywhere in the mouth starts moving forward. The other cool thing about babies is that their gag reflex, the trigger point of it, sits very far forward in the mouth. So you and I can it's kind of gross, but we can put our fingers or
Yeah.
food or something pretty far back there before we feel like we're going to gag. It's actually
Yeah.
close to the back of our tongue before we start to gag, or the back of our palate before we start to gag. And infants' gag trigger is around the middle point of their tongue. So things cannot get very far
Oh,
back
I love that safety.
before the gag is triggered. So it's actually really challenging for babies to move things back in their mouth. Everything wants to stay forward, which then triggers the chewing reflex. So that food stays here, triggers the chewing reflex, starts to move back, we gag it forward or we push it forward, trigger the chewing reflex. And it's naturally building their ability to chew while naturally protecting their airway. And I didn't even go in, there's like 5 other mechanisms that help protect the airway while baby is doing that. The gag is just the most obvious one, and it scares parents.
It's scary. It's scary. And Dr. M, can you just tell us, now that Kary did such a good job of explaining the gagging, like when to be concerned and what the difference between gagging and choking are?
Yes. So Kary, correct me if because they have so many good tidbits on solid
Both of you
starts.
do.
But the biggest one too is choking is actually it can be silent. like you can hear your baby gag. It's like
Yeah.
like because it's that kind of internal reflex doing that. And actually when your baby is so that's gagging, and then choking is actually a little bit more silent because it is like your baby is actually having a hard time taking it from that front of the mouth to the front, and that is when you can start to really see airway issues. So if it's a more silent thing, if you see any degree of discoloration around the mouth, especially in terms of like bluish, like those are actual signs. So that's why we always say certainly every parent should learn infant CPR.
CPR. Yeah.
That way you can really quickly understand how to do back blows and do that. But I think like that feels scary when you even think about, oh my gosh, my kid is choking and I have to do back blows. But what I really want to focus on is everything Kary just said is these intrinsic mechanisms that our body has. We've said 3 different things on this call so far that I hope is really reassuring to parents. You asked, as you wean down breast milk and introduce solids, will your supply be enough? Intrinsically, the answer is yes, because we're designed to do that. Number 2, babies over time, whether it's in their infancy or their toddler, they will self-regulate the amount of food they need over the course of a week and the amount of liquid in terms of hydration that they need, right? Like we have thirst mechanisms that kind of come from the brain that really like tell you that you need to drink. And then everything that Kary just said, intrinsically, we are designed to not actually choke and rather gag instead. And so those 3 things are just, I think, one of the things about starting solids, it feels scary, but when you can understand that we're actually designed to do it and that we have intrinsic protective mechanisms to help us through these things, it again takes the pressure off of parents. So,
And I saw a lot of questions about the life hack. What we will say there is what Dr. M said. Every parent should really know infant CPR, and the tools that are out there don't replicate that. And always, if you're unsure or think you're in an emergency, to call 911.
We also that the
Yeah.
life back is not like approved for, licensed for infants.
this age, that's right.
It doesn't fit their face. So while, it may be something that you want to have in mind again for grandpa or grandma or for an older child, there is nothing that beats knowing appropriate choking rescue. And we know from the literature that choking rescue is extreme when it's administered timely and appropriately is highly effective.
That's right. That's right.
That is so reassuring. Okay. With 15 minutes left, I want to be respectful of everyone's time. I think it's time to switch gears to allergies. And let's just start with what parents need to know. How can parents introduce allergens safely and confidently? maybe with the amount of allergens that should be introduced at a time and how to introduce different allergens. And I love when Kary hits us with the 9
I
allergens.
know. I always love it. I'm like, oh, this is
Yeah,
great.
yeah, he's so good at it. Can you do it, Kary?
I'm never sure, honestly.
Yeah.
Okay, so there are 9 common allergens in the US, or 9 foods that are considered to be common allergens because they cause the vast majority of food allergies in the United States. So the 9 ones, and we call them, the big three. So egg, dairy, and peanut are the big three, but there's also tree nuts. There is wheat, sesame, soy, shellfish, and finfish. Yeah, did it.
You did it. You did
Um,
it. The
so
big three is a trick because then you really only need 6.
Yeah.
Exactly. I learned that helps me. And those big three are the ones where we have the strongest research to support sort of plan for introducing them. And those are the ones that tend to cause a lot of food allergies. So for those big three, peanut, dairy, and egg, we often push parents to introduce those ones first before the other ones. Although wheat is a really common one where people like to serve baby noodles and bread and things like that. So you may want to get to that one earlier too, or depending again on what your family likes, you might want to get into fish very early on,
Yep.
or some of the other foods that are common allergens. But the research shows us now, and it's flipped because Dr. M and I have been doing this for a long time, and we did not used to know this. The research is really clear that early introduction is important. And when I say early, the vast majority of babies should be starting with those common allergens about the time they start solids. So right around 6 months old. They don't have to be the first week. It's okay to push them off a tiny bit, but we want to get to them pretty quickly and we want to keep them in the diet regularly. So
Yeah.
our allergist says early and often. And by often, the research shows around 2 times a week. So once you introduce a common allergen like egg, it's not like, cool, checked off the list, let's move on. You've got to keep egg in the diet regularly to have the maximum reduction in the risk of developing a food allergy to that food. So like peanuts, you got to introduce it and keep it in the diet regularly to keep your baby's risk low of developing a food allergy.
And
And we
Dr. M,
know
I
that
think, oh, go ahead.
I was going to say, we know that the research shows that when this study came out, it was actually during my residency time. I remember the study was occurring, and then the new recommendations, we used to say avoid any allergens until after their one, and then everything switched. We now have enough time has passed since the recommendations have been in effect. Pediatricians and pediatric, healthcare providers have been recommending it. People are doing it, and now we are enough out to know that that reduction is significant in terms of what it does for the vast majority of patients. It really does reduce your risk of allergy. So I just want to point that out, that it's been enough time that we know it really is working in a good way.
I
Yeah.
want to come back to allergens and eczema, but I just have one quick question, Kary. For eggs, is it egg yolk or egg white that's the allergen?
So it's actually, I mean, it's all of it, but you do want to cook your eggs. You have a lower risk of having an allergic reaction to a well-cooked egg. So the first egg you want to introduce is actually well-cooked egg, scrambled. That's
Got
the
it.
most ideal way to do it.
And
Um,
Salad Start has such a good way on how to cut everything, but I just happened to look at egg today.
like that's one of my favorite parts of our app is how we walk you through introducing allergens, especially egg is a great one. We recommend starting with small amounts and doing it consistently over 3 days, but you can go into the app and we'll walk you through it, like exactly what you need to do. But egg is a really common one where people have heard that it's the yolk and they should stick with just the yolk or they should stick with a runny yolk when the reality is a well-cooked egg is actually less likely to trigger a response. So you want to start there and then build up.
I like to think that we really make this event not about pushing the products that we recommend but I just want to say, first of all, Ahimsa is my favorite. You know that, Dr. M. But Solid Starts, I'm seeing a lot of questions on like, what are the best foods to start? How do chewing foods work? Solid Starts makes it so easy for you to know. It's literally every single food. It tells you by age how
Yep.
to serve it to your child. So if you need inspiration from parent to parent, it is such a good resource. Okay, Dr. M, back to you on eczema and allergies. Are those two things connected?
They are. They are. So when we talk about food allergies, um, a lot of things that happen in our bodies that they look the same, like the choking, gagging. Actually, allergies is the same way. So food allergies and eczema is an immune response. So it's kind of, our body thinks it's fighting something that it actually shouldn't be. So when we get a virus, when we get a bacteria in our bodies are naturally designed to flex that immune system and create this immune response to fight that infection. Sometimes it gets a little confused and our bodies will fight something that is not supposed to be fighting. So for example, a food that it sees, it thinks that it's, something that needs to fight, and it mounts an immune response. That's actually what allergy means. It's kind of an inappropriate immune response to something that, you and I might not be mounting a response to. Eczema is the same thing. It's kind of an immune response, and that it shows up kind of on the skin. And so we see a lot of like itching and specific kind of scales with eczema. So those two things are related, food allergies and eczema. And so when we talk about introducing early allergens, the only one kind of set of population, or there's two sets of populations that we say proceed a little bit with caution in terms of talking to your pediatrician first. If your child has severe eczema, they are more likely to already be mounting immune responses. And so because we know, they have, some degree of severe eczema, they might be more inclined to mount a response. So let's make sure and talk to our pediatrician first. And the other is, if your child has already a known allergy to one food group, they might be more inclined to have an allergy to another. So those two things are related, and you should talk to your pediatrician first.
Great. And Dr. M, while you have the mic, just what does an allergic reaction look like on a baby's body?
Yes. So when we think about food allergy, again, it's an immune response. So some of the hallmarks, we talk about food allergy and food intolerance. So they're just a little bit different because a lot of babies can get, so food intolerance is really more, not that your body is mounting an immune response, it's just some sort of irritation. It might, like a food intolerance might be irritation to the GI tract. They might, have a little bit of diarrhea, or they might actually like have a little upset tummy or some gas. Like it's really irritation. It might be irritation to the skin where you just see a little bit of redness. And so that's food intolerance. That's different than food allergy, where your body is mounting immune response. So that skin kind of rash becomes hives. So it's not just redness, it's raised redness. Typically, like you'll see it kind of in splotchy parts around your baby's body. The other area that we see it, if you are seeing your child like with a lot of vomiting suddenly, that's another sign potentially. And certainly respiratory. So if your immune response is attacking your respiratory system, you might have difficulty breathing, wheezing. These are all signs of an allergic reaction. The other difference between food allergy and food intolerance is food allergy happens pretty quickly. So it's not going to be like days later, my baby's having this allergy to this food. So typically it's within minutes, within a few hours, whereas food intolerance can be kind of a delayed onset. So if you ever see that your child is having, multiple things happening at the same time, hives, vomiting, and any degree of swelling around the lips, that's like immediately call 911 because that is a true like allergic reaction. You can also call your pediatrician. Sometimes they will recommend, if it's like a mild allergic reaction, to give some medication to decrease that immune
That's
response.
coming up a bunch. Should you have medications at home on hand for these types of reactions? I want that question answered if you don't mind, Dr. M. But then also, does intolerance lead to potential allergy? So two questions. Okay.
Yeah, so I'll answer the second one first. No, because they're different mechanisms. And so it's, really what increases your allergy response is your body's like kind of predisposition to mounting inappropriate immune response to something that is otherwise normal. So that's actually just totally different. And then the first question,
the medicine at home.
the medicine. So especially with babies, please don't ever give your baby a medicine without talking to your pediatrician first. Yes. Because there are like very specific indications, especially like when we talk about allergy medicines, the things that we think about are like a Benadryl, and because it like helps with the immune response. We don't want anybody giving medication to babies specifically without talking to their pediatrician. And, like we don't even recommend any sort of cold medicines, for example, under the age of 2 for lots of different side effect reasons. So it's something to always talk to your pediatrician first. So if you have a known food allergy, right, and you are in contact with your pediatrician or your pediatric allergist, certainly epinephrine, inhalers, all of those things on hand are life-saving and something that you should be carrying at your doctor's discretion.
That is so, go ahead, Kary. But that was very helpful, Dr. M. Thank you.
Yeah, so much good information there. I love it. The two things I want to add is just a plug for an article that we have in the app that I love that shows allergic reactions on a variety of different babies. And I like it because it makes it really clear what allergic reactions can look like. It answers a lot of parents' anxiety questions around like, well, my babies have rashes. They're so rashy. It's absurd.
Oh, they have
So
so many
rashy.
rashes.
And like there's always that question of like, well, what about this? Is this an allergic reaction or is this just a regular weird rash? So that article is incredibly helpful for parents. Again, it's also pictures. We've tried to collect a wide variety of skin tones, which it can be really hard sometimes to identify patches on certain skin tones, especially darker skin tones that sort of mask that red color.
Yeah.
So that is a big plug for that. The other thing that I just want to say, because I've seen that several questions come through, food allergies are quite rare. So there's a lot of anxiety. It's like the choking thing. You have this high anxiety
Yes.
because it is such a wild thing to happen, but it is very rare actually for a baby to have an allergic response. So the likelihood is that the vast majority of babies here won't have an allergic response when you introduce those foods, especially if your baby is considered in the low risk bucket to start with. And Dr. M talked a little bit about what puts you in the high risk bucket. You can also find that in our app, that information, or you can Google it, what puts you at high risk for allergies. Dr. M said it. But if you're low risk, the likelihood is very rare. So it's not like you need to have all these medicines on hand and expect an allergic reaction for most babies. That the reality is that won't happen.
Okay,
And
amazing.
I know we only have a minute left, but I do want to like
What, Mars?
Kary and I both have children the same age.
Okay.
And so I think it's really important. I have twins who are 12 years old and then a 9-year-old. Kary, I think you have 13 and 10. Is that right?
Yeah.
And I think
And they eat today?
And they eat really well.
Right.
And we, like Kary and I always talk about this. So like there's so many people here who are in that kind of infant stage or in that toddler stage. And it is really hard to kind of see that finish line. And I think we are walking examples of kind of using evidence-based medicine combined with kind of just maternal instinct. And if you can kind of pair that with just like enjoy it and like spend the time to do it now, because really it is one of the best investments you can make in the long-term health of your children. And know that like showing up to this call, the kind of questions you're even asking, you're doing the right thing already by educating yourself and empowering yourself to make this investment in your child's health.
I love that you said that. And I think you two both do such a wonderful job of making this really like a fun experience, because it should be. And take your baby to the grocery store, show them what you're buying, make them foods that you're eating at home. Dr. M, we didn't really talk about it today, but I know you're a huge fan of flavors in food. So if you like flavors, you can explore that. I just want to clarify for one question, if you're okay with it, Dr. M, to end on. Where was it? It was about that if your baby's showing an intolerance, do you need to stop giving that food, or what do you do? I don't see the exact question now, but that was kind of the gist of it.
Yeah, I mean, if there's a specific food that kind of makes your baby fussy every time, like maybe just don't, do that food.
Or rashy?
Now,
Is that like, what if it made them rashy?
Yeah, I mean, if you have rashes that are not like hives and kind of allergic, it really is up to your discretion on whether if it's not like a lot of rashes, just don't bother babies, right? And so if your baby's not bothered by it, so it's not an all or none kind of response. You really have to kind of see what you're comfortable with, what baby's eating. And at the end of the day, what really matters is that you are offering your baby, and as they kind of grow up, a variety of foods. And so if there's one food that is making them kind of feel uncomfortable, but it's not an allergy, there are a billion other foods that you can give them that they might like. And I'm sure we'll talk about that more when it comes to picky eating in toddlers, because that's a whole
Yes.
other reason.
We definitely will. Just to highlight again, we have another event with this crew on January 20th, all about allergens. I sent the link in the chat. I'm seeing a question, should we make sure anyone who's alone and feeding the baby knows infant CPR? The answer is yes. And then just to end, first of all, thank you to Dr. M and Kary, but so many questions coming in about the recording. You will get the recording via email. It will link you to this event recording on what we call Auggie TV. And Kary, I may ping you because maybe we can get that resource on what different rashes look like and also include that in our follow-up. I know we can probably link to it in the app. Okay, Dr. M, is it IU? Go IU?
Go IU.
Okay.
Everyone can hear the Hoosiers on tomorrow. Yeah.
And Kary, thank you so much. And we'll see everyone soon. Thank you.
Thank you.
Bye.
You all are doing a great job. Keep
Great
it up,
job.
parents.